for the abstract presented by Dr. Halford et al. Regarding the long-term efficacy and tolerability in patients with Dravet syndrome over the 3-year interim analysis. It shows that the efficacy of cannabidiol in Dravet syndrome is maintained, and that's really nice to see over a 3-year outcome, because that's a very long-term outcome study in Dravet syndrome, which is a very hard to treat form of epilepsy. So it gives us that additional data. It also shows that the side effect profile of the medication over that period of time was relatively comparable to the adverse effect profile that we saw in the 12-week primary outcome study, which led to FDA approval. And as a result, we didn't get surprised by any rare or idiosyncratic reactions to the medication, which is really nice to see over a 3-year period. The significance of the study is that they followed the patients out for a longer period of time, and they also permitted a higher dose of cannabidiol at the highest used dosing interval. They went up to a dose of 30 milligrams per kilogram per day, which was not permitted in the study that led to FDA approval, and they followed them longer. And the combination of those two factors really gives us more peace of mind and relief about the side effect profile for cannabidiol. The incidence of dropout due to adverse effects was only about 9%, which is remarkably low for a seizure medication. Seizure medications are often part of a person who has epilepsy's life that they really want to do everything they can to avoid, and they really don't like to stay on them if there are side effects. And so the fact that 91% of individuals were willing to stay on them, when you take side effects into account, is pretty remarkable.